Welcome, welcome. So, jumping in straight into the
Jump in.
interview. All right. So, what is your why? Why did you start and launch your company? What were the problems you felt like you were solving? Like what needs did you see in the healthcare world?
So both my business partner and I both started our careers in Medicaid enrollment. And so we saw a better need to merge the people process of Medicaid enrollment with technology and also screen for some of the social determinants of health. So we truly believed our why, and my why personally is always to help people. So with Medicaid enrollment, it made sense to me because we're helping the patient, we're helping the facility, we're helping families, to be honest with you, get someone enrolled in Medicaid and they're able to get their hospital bills paid. And so we saw that it's a very people laden business. It's very heavy on people, which is we don't disagree with. It's always going to be a people business, but we built in some really unique things. We built a better mousetrap with regards to screening someone, also looking at some of the social determinants of health. We also built a tool around real-time insurance discovery. So we're able, before we go to the floor to screen a patient, we're able to see if they have if they actually have insurance. We're not looking at just the top 10 payers. We're looking at multiple payers, and we're creating some real AI in that space to look for insurance. So my people aren't going up to the floors to screen a patient to see if they're eligible for Medicaid, and we find insurance on them. The other thing we wanted to do is I feel very passionately about hospitals getting paid for the services they provide. So denials are where I spent 10 years of my career, and to build a denial team has been really a lot of fun, because I believe that providers act in good faith and should be paid in good faith. So with that, we built a really nice, unique system. We also built real-time claim statusing into that. So one of the biggest issues I saw was, on top of fighting the denial and writing the appeal, you'd have to have somebody on the phone to find out what's going on with that claim. With real-time claim statusing, even if we're able to take 50% of those claims and find out about them through IT, it just alleviates the burden on all parties. So my why is always to help people, always, and that's been the catalyst of my entire career. And all people, I think that everybody needs a hand up sometimes, and then building better mousetraps for the provider and for the patients as well. So we included, for example in the Medicaid enrollment space, we make it easy for patients to submit their documentation by partnering with DocuSign. They can sign on their phone. They can capture document images on their phone with a click of their button, take a picture of it and send it to us. We're just trying to make it as easy as possible for patients to get qualified for Medicaid. So it's been really a fun process in helping people and merging people and tech.
Okay. So I'm going to take a step back real quick. What was your education path? Like what mentors did you have? And how did you kind of get to where you are today?
I mean, the number of people that have poured into me are innumerable. I mean, if you go up high school, grade school, teachers, family, obviously, um, just been so blessed to have so many people pour into me. In college, Dr. Weist poured into me, Dr. Ranella, and then to move into and ran a wilderness camp for mostly served kids. I had Chief Richard pour into me, Chief Boschwitz, Chief Rick. I mean, just so incredibly blessed. And then when I got out, just and got into the actual care of healthcare and doing that. Kevin Groner at APA, Julie Shaw, Kathy Daugherty. I mean, the list is endless. I can name so many people that have poured into me. I'm so blessed by the South Carolina chapter of HFMA and all of the members there, and just HFMA in general. I've been blessed across the spectrum with so many people that have just spent time helping me and developing me. Just incredibly thankful, and I mean, it's thousands of people. It's too many to list, but just so many. I mean, my crew here in Nashville, my boys, they take care of me, and my family, of course. So it's just been an amazing journey so far.
So who do you think gave you your big break? Like who took a chance on Jude
Well,
Crowell?
I would say two folks really stand out. Number one, the South Carolina chapter of HFMA.
Mhm.
But the first client I ever signed was Northern Hospital, Surrey County. Joanne McNamara up there, great little community in Mount Airy, North Carolina. And that was just a great experience. And then definitely in the past couple of years, my dear friend Michelle Napier at Orlando Health has just, without her and her putting faith in us to do a great job for her. I mean, she's brilliant and amazing, and it's just so blessed by her involving me. And yeah, without her, I don't think Invicta starts up and gets moving. But she put her faith in us, and I think we delivered.
Amazing. Okay, so going forward
Mhm.
in the next 5 to 10 years, how do you see healthcare changing? How do you see RCM changing? Healthcare revenue in the next 5 to 10.
I think you're going to see a lot of artificial intelligence in that space. I think you're going to see a lot of AI, but there's still going to be a lot of opportunity for folks to be involved and like I said, build better mousetraps. I think you're going to see a consolidation of providers, and you're going to see a consolidation of vendors. I also think that truly, in order for there to be true change, the number one issues right now are with payers. They when you think about a payer making infinite more money than the provider, it's kind of silly to me. So until there's that gap filled, so the payers and the providers come together, there probably has to be some profit redistribution there in terms of, when you think about United Healthcare making $24 billion in a year, and the largest provider of actual care making 5 to 6 billion in profit, and that's a for-profit health system. That there's something skewed there. Most providers are barely getting by 1%, if 1% margins, and then you have payers with obscene profit margins. I think there's also some resettling in the private equity space as well. When you talk about profitability and vendors, and like the expectations have to be cooled down. Healthcare is very personal, and it's very much so. Ripe for some adjustment. You have AI coming in. I think that's going to be very influential in our space. I also think we have to get to a reconciliation with provider and payer. Have to, and with a balance of PE, like the expectations are through the roof, and we need to temper those expectations, I think.
Okay. Well, thank you. I
Yes, sir. Of
appreciate it. Well, to kind of finish off real quick, I do want to give you a little fun little question to throw
course.
in there. The Olympics are coming up.
Woo! Go
What
USA.
event are you most looking forward to see in the Summer Olympics? And then, like, who is your favorite Olympic athlete?
So I think I'm most impressed with the track and field athletes. It amazes me to watch them do their thing, and how fast and just powerful they are. It's just amazing to me. I think my favorite Olympic athlete is it's kind of random, but it's this guy named Eddie the Eagle from Great Britain. He was in the long jump in the skis in the winter, and I love that he was terrible. Everybody beat him, but he was out there like every time trying it and doing it and fearless with it. And I just I remember as a kid, like that guy's terrible, but he's putting his best out every day. He's out there trying every day. And there's so many people that miss that. They just miss it. Like you got to be on the field of battle to win. And he was out there. He knew he was terrible, but he was out there. And I love that about him. Like he put it all out on the field. And even though he wasn't the best at it, he was out there trying anyway. And I love that. I love it because I've never been the best at anything really, but I'm out there trying every day.
Okay. Well, that's everything. That is
Wow.
amazing.
I
I
appreciate
love the Eddie the Eagle story. Big fan. Well, I mean, they did a movie with it and
I,
everything.
I've heard that. I've not watched the movie. I'm just like,
Okay.
as a kid, it was like, this guy's terrible, but he would go in there trying. I love that.